Most people think detox is you went to rehab because you got a drug and alcohol problem, right? And they don't understand, from a cellular standpoint, in a whole system body standpoint, of the environmental burden that they carry on a day-to-day basis. So there's a lot of education that's involved in that, and seeing a panel that gives them a sense of the things they're getting exposed to and what levels they are compared to the background data we've got is really helps engage them, and then bring them into the fold, essentially, to help them, modify lifestyle, clean up their topical skincare products, their food supply, because I can't detox them if they're going to continually retox themselves on a day-to-day basis.
Hello, and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmie Brown. Today, we're thrilled to welcome Dr. Carl Paige and his wife, Terri Paige. After practicing more than 30 years as a board-certified pediatrician and internist, Dr. Paige took the vast knowledge he obtained working with patients and began investigating innovative ways to address his wife Terri's long-term gastrointestinal and autoimmune issues. In researching possible causes, he became increasingly convinced that lifestyle, genetics, and cellular health may explain the underlying mechanisms and origins of sickness. Today, Dr. Paige's practice seeks to strengthen and optimize individual cells, which in turn work to support the whole body from its most basic unit up. We also have Terri, and Terri is the CEO of Medical Transformation Center, fellow of the International Seed Scientific Research and Performance Institute, and certified lifestyle coach through the American Academy of Anti-Aging. I can't wait to learn more about their trailblazing approach to cellular medicine and longevity today. Thank you so much for joining us, Dr. Paige and Terri.
Thanks you for having us. Yes.
Of course. Yes. And so I mentioned a little bit there, and I hope that it's okay if I found this in your bio, Dr. Paige, that part of the inspiration to seek root cause medicine and go beyond the traditional model was your wife Terri here. Is there anything about that experience that you want to share today?
She had been through a lot of stuff health-wise, and she probably tells that story better than I have. But with 8 kids and 6 C-sections and, a lot of GI issues and antibiotics and anesthesia and, all of that happens in that process, it had sort of disrupted her microbiome for sure. And that was before we had really, really good testing to assess microbiome and evaluate and manage more specifically. So anyway, that's what started that process. She can probably tell you more about it if she's
I would love
it
if you don't mind, Terri.
Well, I think it all came to a head in 2008. So that was actually our watershed moment at home, like he said. And it didn't happen overnight. These were things maybe that were underlying for many, many years. But then, certain things happen that tip us over the edge. And like he said, I think after that 8th child and just all of the just different things that my body had been through, it was kind of the lowest point of my health. And so I did have a lot of GI issues. I had some autoimmune going on. I had a lot of anxiety and depression. I would get recurrent infections. There was just so many things going on. And it was frustrating because at that point, it was Carl had a very conventional medical practice, traditional allopathic medicine, where so often it's just, here's a symptom, here's a diagnosis, here's a med. And that was certainly, I had a handful of meds to address symptoms with no real answers. And it did hit the fan at one point, and maybe I was a little extra unhappy. But it did motivate us to, motivated Carl to dig a little further and research. And that was where he started to talk about GI tract health. And like you said, at the time, we didn't have a lovely test to really give us the empirical data. But, just knowing that background and understanding if I did certain things and started to work on my gut health and my microbiome, potentially I could have some better health. And so that was enough motivation for me because I was at rock bottom. And that just started that trajectory. We started to make changes at home and to learn about that a little bit more. And ultimately in 2011, decided that we wanted to take that into our insurance-based primary care to help our patients be well, as opposed to just being reactionary more often than not. And I really did think we were going to do that in that traditional practice, but ultimately in 2013 just realized, this is a square peg in a round hole and we need to create a different model to deliver this type of care.
So your experience was really the inspiration behind the Medical Transformation Center and the practice today. It sounds like, because before you weren't really doing integrative medicine in the practice.
Well, I always integrated things other than the traditional Western medicine into the practice. And some of it I learned on my own, some of it I did some indirect, informal training in. But so I was always open to that space. And it was just how do you fit that into a traditional model? And really, to were the patients that were in that model, was it their expectation and is it what they were looking for? So, some of them were, but a lot of them weren't. They just wanted the traditional, give me my blood pressure pills and cholesterol pills and sugar pills and see you in 6 months,
Right. Well, they didn't know what they wanted at that
They
point.
don't
You
know
had
what
to
they
show
don't
them.
know, right? They don't know what they don't know, right?
Exactly. Yes. And you mentioned insurance, and I'm a big advocate for access to the type of medicine that we practice, functional medicine. Oftentimes, there's not much access there, so that's very close to my heart. But let's dive into cellular medicine first. I'd love to know, what is cellular medicine, and how are you using it in practice, and how does it compare to conventional practice?
Well,
And
I
either one
think,
of you, I'm sure you both
sure.
have different takes on this.
I mean, cellular medicine is, I think the whole space that we work in, if you're not a Western medical doctor, it's like, what do you call what you do? So there's a lot of branding and marketing names that people have, and even functional medicine. For a while, we use that. We still use functional medicine as a tool. As I understand, people look for that, but what do all these terms mean? So it's not well defined. There's not the you don't go see a pediatrician and it's just kids, so I don't think people understand, like you said earlier, what are they looking for? How do they seek out this type of care? So, and then what do you get when you show up at a functional medicine practitioner? What are the expectations? What are you going to see in that space?
Right.
So, um, we use an integrated practice where we use Western allopathic medicine. We may use repurposed prescription medicines. We may use nutrition, diet, lifestyle. We will use peptides, supplements, botanical things. So it's really trying to take the best of all of those worlds out there that we have to help people achieve health goals and achieve wellness and optimal health function. Cellular medicine really addresses those things from the ultimate root cause on up. And we are a multicellular organism and made out of multiple cells. But if you can make that individual cell from a metabolic standpoint, an energy standpoint, an inflammatory and immune standpoint function at its best, then the multicellular organism is going to function at its best. So we work with SSRP, which is Dr. William Seed's program and organization, and we've been with that since its inception. And I train other doctors in that space to help learn how to use these multiple tools. But it's also, how do you evaluate and assess that patient, as opposed to just always identifying a diagnosis or a symptom. It's like, what are the things that aren't working right here on a cellular, biochemical, physiologic level? And how can we best evaluate those, either by advanced diagnostics or by just literally symptoms that we see in a patient, and help optimize the function of that cell to achieve its best ability to perform.
I think what's exciting about it is that it combines the best of so many different worlds. I always tell people, we haven't thrown away the traditional allopathic medicine tools. We've just added on, and we have this huge toolbox, which is exciting. But when you, and like Carl said, we used to say we were an anti-aging, regenerative, and functional medicine practice. And we would just, like, I think as the years went on, and that was starting back in 2013, as the years went on, maybe those definitions have changed a little bit. And we've evolved as well. So really being able to think through, like he said, to be able to think through, okay, here's what's happening, but let's go back X amount of steps, way, way back, and try to understand from those cellular pathways, those basic cellular pathways, what is malfunctioning and how can we get those cells to be more flexible and more adaptable, so that again, that human, that larger organism is at its best.
Right. Yes. And I'm wondering, as far as assessments go, I do want to touch on laboratory testing. What's on your screening panel for maybe someone who's coming in and they don't have symptom complaints, they have unremarkable medical history, but they're coming to you to optimize? I think there are a lot of people who are just health minded and they want to optimize. So, what kind of screening panels are we looking at? And really, how are we assessing cellular health and function?
Some of the basic things are hard to assess. What is the redox state of that cell at the moment? What is the pH at the moment in the serum? So those type of things are difficult to measure in real time. Just to give us, we order a lab and 2 weeks later the patient shows up. So it doesn't mean it's the same thing at that point. So measuring those in real time at the moment is difficult. So we look at a broad spectrum of serum and proteomic type markers in the serum to assess inflammation, assess sugar metabolism. How is the patient, utilizing energy in an efficient way. It's common labs that you might do at the regular doctor, but it's also much more advanced proteomic markers looking at the immune system and at inflammation and at gut health. Um, it's you know what they are because it's your guy's lab. So I don't want to spout them all off here as far as individual markers, but there's in a multifactorial way, you look at the system, how it's functioning, and take those pieces and put them together to get a sense of how is that cell efficiently using energy. What is its flexibility to burn energy? What is the inflammatory state of the cell?
Right.
So it's looking at markers in that context. And
Hmm.
it's probably more of a how do you contextually look at all of the labs that we're familiar with using, but looking at them more at how is it giving us information of how that cell is functioning.
Hmm. And what about patterns? Are you seeing patterns that are particularly helpful or tracking risk based on laboratory result patterns?
Well, we try to do a risk assessment. It's going to be a lifestyle risk assessment, and it's going to be what genomic markers we have decent data on that can give us some potential short or long-term risk for patients. Just something as simple as ApoE. It's funny to me how patients come in and they've never even had that evaluated. So we don't have, looking at genomics themselves, SNP assessments used to be the thing a long time ago. And you get these still, we still see people do giant SNP assessments and they come in with this because you have these SNPs, then you need certain nutrients. I wish it was that simple. Okay. It's really not, right? Um,
Same.
yeah. There's a few of them that might give us some clues, but it's not, it's just peripheral data that you really want to know how is that gene expressing itself, and then you get into doing genomic expression testing, which is still very in its infancy
Mm,
stage, so not great useful on a clinical level right now. These age markers of how old are you, what is your telomere length. I love all of this technology, but as far as taking it to the clinic today and using it's not really had tremendous utilization to give us, moment to moment or day to day direction on how to take care of people. But I still use a lot of the proteome. We use genomic SNP testing to give us a sense of where this patient might be at risk for things, and then try to manage optimally hormones, try to manage metabolism, energy assimilation, and nutrient assimilation. Those type of things are still the root of what we use to help evaluate and manage people.
I mean, and then you pull in, toxic load too. That's another piece, and
yes.
underlying viruses and viral load and infections and co-infections. That seems, that can be relevant for so many people, especially in the post-COVID world, right?
Absolutely.
Absolutely.
Yeah. Yeah.
And even just risk in somebody who's feeling well, I like to see what their exposures are. And I tend to notice, speaking to patterns, when I'm speaking to healthcare providers, we get a lot of providers who are ordering tests on themselves as guinea pigs to
Of
learn
course. Yeah.
interpretation, of course. And I just anecdotally, I see this person is well educated. There are no phthalates, very low BPA, no
Mhm.
parabens, in terms of the topical product education and what we're putting on our skin and putting in in our bodies. Sometimes I see, who's maybe a little bit more well educated. I think that's fascinating. And it is something so straightforward and foundational, I feel, that we can focus on with our patients in terms of the tools to recognize, to make healthier choices. So thank you, Terri, for bringing up the toxins and Dr. Paige in terms of those tests that you're looking at. I imagine micronutrients is probably a one that you're paying attention to as well. Um, what about
We like
mitochondrial?
micronutrients. We like
Yeah,
the toxin panel is unique to me because everybody should have something in there because we live in such a dirty world. So the
exactly.
patient I honestly worry about the most is when we don't see anything present because then I realize that they can't even detox, and push that
Yes.
stuff out in their urine and they concern me actually more than the ones that have a little background of the common things you see when you look at one of those panels. The mold, toxins, or it's always a sort of a popular thing now, but they're there, and then predominantly they end up being mostly in patients' food.
Yes.
Is where they most come from. There's that environmental, sick building thing we see, but it's most commonly in the food supply. Yeah.
Absolutely. Yeah. I'm so glad you brought that up, Dr. Page, because it's very uncommon that we see a completely normal, total tox panel. And when it is largely normal per se, I'm starting to ask, what is detox capacity in terms of liver enzymes and kidney function? So I'm wondering clinically, kind of how do you assess patients' detoxification capacity? Are you looking at those same parameters? Also, clinically, is somebody constipated? That's a priority of mine.
Well, the gut has to start there. If you can't sweat, you can't poop, you can't pee, then you're not going to detox. So, um, those are the simple questions we ask, and then try to merge those with some of the advanced diagnostics that we use, particularly through Vibrant for those type of data, because many times I'm having to explain to the patient and get them to buy into this concept. Most people think detox is you went to rehab because you got a drug and alcohol problem, right? And they don't understand, from a cellular standpoint, in a whole system body standpoint of the environmental burden that they carry on a day-to-day basis. So there's a lot of education that's involved in that, and seeing a panel that gives them a sense of the things they're getting exposed to and what levels they are compared to the background data we've got is really helps engage them and then bring them into the fold essentially to help them, modify lifestyle, clean up their topical skincare products, their food supply, because I can't detox them if they're going to continually retox themselves on a day-to-day basis.
Exactly. I'm curious, what are your favorite tools? I'd love to hear from both of you. Favorite tools to educate patients on how to maybe clean up their skincare and maybe revamp the kitchen, so we have healthier cookware. How do you educate them in this way? I know I have my favorites, but I'd love to hear yours.
Well, go ahead, Trish. She does a
Well,
lot of that.
I do a lot of the education with our patients, and you're right. I always tell them. I always lead off. We have some very. I teach 8 classes a month. On I always 101 is the why, and 102 is the how, and then we continue to build from there. But understanding that background of our microbiome and how important that is, and what happens when we have leaky gut and we have gut permeability and all of those things. But then how does that happen? How do you even get in that situation? So it's going backwards and trying to educate them because, like all of us, when we understand why, it's easier to do the how, because sometimes the how are things that you really don't want to do.
Hmm.
Do I want to give up certain things that I'm used to eating, or to, clean up or change groceries or shop on different aisles in the grocery, give up my favorite whatevers, and my colored foods. But then again, too, talking about what you put on your skin, it soaks in what, 26 seconds? It doesn't take any time at all, and how that contributes to toxic load. So it is definitely like peeling an onion. And so oftentimes what we've learned over the years, because, sometimes I'll say, let's do it all, right? I want to do it all
You
right
get
now.
excited.
Nobody wants to do it all right now because it's hard. And so that takes a lot of, that's been taking some retraining on my part and my general outlook on things, to remember that when folks are making changes, it's better to do it like peeling an onion, because incrementally, just pick that one thing. Let's pick that one thing, and now let's move. And so we spend a lot of time on that. We do cooking classes, and we have ebooks that we have put out for our patients, the reminders. We do a lot of touch points with our clinical team at different periods in their journey, if the patient's journey with us. So, and then we have an ambassador program where we're calling in monthly and checking on our members. So it's, it really is, the more engaged people can be, and the more we have events. So we want to bring them in and bring them into the fold. We kind of think of it like a family,
Sure.
our members, because it's, and our facility, we designed it so that when folks walk in, first of all, it doesn't look medical. It looks more like a beautiful coastal home inside, which is kind of fun, whites and wood and all of that.
Relaxing.
But the kitchen slash break room is right at the front where the waiting room is, and it's separated by a glass wall with doors. And the reason we did that, we do have events in that kitchen, and then we open it up to the waiting area. But it's actually nicer than my kitchen at home. But it symbolizes something, how we nourish ourselves. It's so important there to start with that, because all these fancy tools that we have, I always tell them, the peptides and the advanced testing and all of the other tools that we have, you're not going to get the best use out of if you don't partner with us, you being the patient, and change your lifestyle and take it to heart and start to make these changes as you go on. And that's sleep, it's rest, it's exercise, it's all of those lifestyle components.
All that foundational stuff is extremely important for the other additional therapies to hold up and best perform. I love that you say that. And I love that you paint the picture of the kitchen. And I'm envisioning that you probably have low tox, no tox cookware. And so it's an example. It's a real life example for patients to say, oh, these are going to be healthier options in addition to the foods that you're cooking. I'm curious, are you asking, I know it can be a huge, long intake process, or maybe an exposure questionnaire. Are you asking about products that patients are using and the plastics that they're exposed to? Are you asking those specific questions?
Yeah, we ask about toxicity exposures, and then the other types, environmental exposures, history of tick bites, insect bites, mold, all of those other things. Yeah, we ask. It's a long questionnaire.
I imagine, and it has to be. It's got to be comprehensive.
What you ate the last 3 days, how your sleep looks. Yeah,
yes. It's all essential. Wonderful. Well, and I'm curious how all of this works into the personal transformation plan. I know this is the clinic's framework for the management strategy, and I'm curious, how do you adapt it to each patient's unique needs? Maybe, is there a real life example in terms of how you personalize these plans?
Well, our process is the patients come in, they see our newer physician. She's younger, 30, which I'm really excited about because she wanted to be in this space after she finished training and didn't want to go into the traditional healthcare space. So she does the initial intake on her patients. Um, then she will assess what's going on, evaluate what they might be at risk for, and then does a set of diagnostics that we will collect. And then the patient comes back in about 3 to 4 weeks and sits down with me, and I review all of that with them. In my office, I've got a big couch. It's usually the patient and maybe a family member, and sometimes other people. If it's particularly a young child or an older person, they usually bring some support with them. And we look at all of their stuff up on a large 70-inch screen in the room.
Oh, wow.
Right, and review it and show them the raw data. And then I'm using a lot of internet tools and illustrations to try to, engage them into what's actually happening in their body. So it's not just a matter of I look at their labs, hand them 5 supplements, and say, see you in 3 weeks. So
It's an experience.
it's an experience. I could probably see a lot more patients if I didn't do that. But my concept is if they don't understand why they're not functioning properly, or why we might hand them several things to change or lifestyle wise or to implement from a therapeutic standpoint, they're not likely to stick with it very long. And they need to also understand, what appropriate expectations from a timeline standpoint they would need to have for a return on their investment. So I spend that time with them, try to educate them, and it's oftentimes like a fire hose of information. We do answer questions individually while we're there, but most of the time, I'm sure they leave with more questions than they had when they got here, and
And
then
that's
they
the
go,
point, probably,
yeah,
right? It's a
yeah,
process.
yeah,
Well, and then we have a step after that. So after our patient sees Carl and they go through, like you said, that long visit, we call it a first follow up. After they go through that first follow up where their hair is blown back and they're like, oh, what did
The
he
first
say?
of many.
Yeah. Actually, then they sit down with one of our clinical team members and do a debriefing because we've found that over the years, again, you learn things as you go along, right? That's really helpful for people after they have listened to Carl give them all of this important data and this information. Then they sit down with one of our nurses and go, okay, here's a synopsis. Here's what we're going to do first. Here's what's next, et cetera. And then they go through and explain that. And then they check out and do whatever they're going to do. And then at that point, actually, we're getting ready to implement another little step into this now that we've realized would be helpful. There's a call in a couple of weeks from one of our clinical team members just to check in, see how you're doing, what questions can I ask? And then actually at 6 weeks after they've had that visit with Carl, we bring them back in to meet with our nurse, what we call a touch point visit. And it's really just okay, now that you've had an opportunity to start to make some of these changes, maybe started on some of the peptide therapies or whatever therapies that we've started you with, let's unpack this a little bit more. What's working, what's not working, what questions can I ask? Because we have found that just doing a visit with Carl and then maybe doing a follow-up in 3 to 4 months, a lot of times that's where people would lose focus, not understand, be discouraged. So that's why we really want to love on them for the first few months, especially. And that's why that's during that time, we're also doing the education and then the ambassador calls. So, some might think, oh gosh, that's overkill. But for us, what we've learned over the years is the more information, the more educated, the more supported, because people don't come to see us because they feel great most of the time. I love it when we do have somebody that just wants to come and head things off at the pass and be proactive. That's exciting. Oftentimes they're a younger person, maybe in their 30s, and they're watching their parents age not so gracefully and they're thinking, what do I need to do? But more often than not, it's somebody who already has some issues and maybe they've been everywhere and not felt heard. And so it's a welcome relief, first of all, to walk in our space. It's all, it's auditory, visual, kinesthetic. They feel it all. And then we really try to support them to be seen and heard and supported.
It's very innovative, this whole approach with those hands-on approaches. And that's a good segue to my next question, which is you mentioned the classes, Terri. Are there any remote learning tools that you recommend or resources, or are you giving homework? And maybe we don't want to call it homework for patients, but what kind of resources are you guiding patients toward?
Well, we do have a number of things that, especially Carl shares with people in terms of resources that he has gathered. Our clinical team certainly has multiple resources. We do remote classes as well,
Okay.
which has been helpful, but we're always on the lookout for what else would be helpful and impactful for our patients. So, it's again, it's evolutionary.
Right. And it can be like drinking from a fire hydrant, as you said. So there's a lot of content out there. I had one guest, she said, we're living in an infodemic. And I couldn't agree more.
Yeah, well, Dr. Google is, he's real smart.
Right.
Well,
Yeah.
and
We
now
need
it's
someone
Dr. Chat. You've got
Yeah,
to,
we call him
yeah,
Chad.
yeah.
Chad is super
and
smart. He
that
knows
just
it.
confuses things even more.
You
Yeah.
have to check him. He hallucinates. Chad does.
So funny. Yeah, that could be a whole nother episode in terms of how to use AI judiciously and
Mm.
effectively, because it's not going anywhere. But I'd love to touch on therapies a little bit. I'd love to hear, I know you do peptide therapy and IV therapy and stem cells, regenerative therapies. What are you excited about right now? Is there anything that is on kind of at the top of the mind that you want to share with our listeners today as far as the therapies you're using?
Well, we address, if the cell doesn't get energy, it's not going to function. So we try to figure out where the defects are in processing nutrients, assimilating nutrients, and getting the cell to process them and burn them. I never thought I would use the Krebs cycle or oxidative phosphorylation, but we use that on a regular basis, and think of it, the patient in that context, that they're not functioning properly at that level. We try to dampen inflammatory response if it's present, stabilize immunosenescence so that the patient's immune system's not attacking inappropriate things and is working on the things it should work on, right? And then really, the neatest thing we've been doing lately is probably stacking some of our neurocognitive recovery peptides and things like exosomes with energy focused magnetic energy to really drive these products into the space we want them to be in, or allow them to more efficiently go into that space, particularly in the neurocognitive arena. So anyway, that's probably the neatest thing we've been doing lately with some of the pulsed electromagnetic field devices we have, or transcranial magnetic stimulation being a specific one.
Now, when we started, we were in small timeshare. We had sold the primary care practice. It was primarily consultation. That was really our model. It was primarily, lab testing, consultation, supplementation, and then we added peptide therapies into that mix. But then when we built our facility in 2021, which we're getting ready to expand, which is
congratulations.
We knew that we wanted to add other modalities, other services, things that would continue to really serve our patients well on all of their goals. And what we found too was, as people started to feel better, they wanted to look better. For us, like we've talked about earlier, we spend so much time cleaning people up, trying to get them as healthy as they can be, that type of thing. When we started to look at maybe adding some things that could be classified as aesthetic, right? Regenerative aesthetic. We always wanted to make sure they were in alignment with our philosophy. So that's where different peptide therapies come in that support skin integrity, hair, skin, nails, as well as using some energy devices that work on remodeling muscle and bone and fascia, therefore muscle and bone and fascia, using, like Carl said, high intensity focused electrostimulation, or, just on the face, and particularly using that to help stimulate and improve muscle tone to develop and lift. So the non-invasive facelift, and then adding stem cell facials, exosomes, things like that. It's exciting, and it's not only aesthetically pleasing, but it's functional as well. When you're talking about, jaw health, jaw integrity, bone, as we age.
It doesn't include any plastic, so we don't put plastic back in people. So there's ways that, you can
or toxins, neurotoxins, or fillers. Yeah.
So
those
been
are exciting.
I never would have thought I would have been in the aesthetic space, but it's like people literally feel better. They then want to look better, right? And we look at our role as to allow them to look better without using some of the things that might give you some short-term benefit, but not be good for you long-term. And that was pretty much this wall was out there at the time was, slap this piece of plastic here and inject this piece of artificial substance in part of your tissue. And we just didn't feel that was the healthiest way to approach aging and aesthetics as we age. And so anyway, that's been what's neat about throwing those in there. And they actually overlay quite well, particularly within, the energy devices with orthopedic recovery and, loss of function over time with the loss of muscle and, and bone density in the whole body, but particularly, in the face, as Terri mentioned.
Yeah.
And then, the brain. So you can get in the brain. That's my favorite space, is the brain.
I know. That's been exciting. We have a new device in particular that it's like TMS 2.0.
Wow.
That's really exciting because it's painless. It is efficient. It's quick. 6 treatments over. You could do 2 a week or 1 every 6 weeks. And like Carl mentioned earlier, we're actually helping with some studies on mapping the movement of when you maybe IV or regenerative therapy along with that, and how it goes to the brain and helps to remodel. I mean, and Carl, you could talk a little bit more about the science with what area of the brain it's working on and so forth, because it's very exciting. So many of us walk around stressed or with PTSD or with depression and or just cognitive decline. And that's what this particular device is really working on.
Yeah.
I
Well,
would love to hear more.
the focused area, you can use transcranial magnetic stimulation devices in several areas, but the most common areas would be dorsolateral prefrontal cortex for, improving coordination and brain function. And, it has some specific clinical indications and then some off-label in use as well. So, that's the neat thing about our practice is that I would say most of it's off label, right? We use it for what it's appropriate for and what it works best for. And that's been fun to practice in that space and not be bound by. And this, it's more like it adds back some of the art of medicine and not just the double blind placebo controlled structured treatment plan that just fits one plan to all patients. We target everything in a very personalized way, directed at the patient's, particular needs, their genetics, their, current nutritional metabolic status. So we really focus it in on here's what's right for this individual.
I can see that. Yes. And I'm familiar with TMS for depression, particularly. But as you mentioned, there's off label uses. And so you have to get creative. And it seems that you've surely done that. And that's an in-person procedure, correct? So they've got to come in. You said 6 sessions, Terri.
Yeah.
Is typical. And okay.
And
are you
combining that with all of the other things is what's neat, really, that, we're not like one intervention, one outcome. I tell the patients, it's like, let's mix these things together. This is the right way to address things. All of the studies, even on traditional medicines, include appropriate lifestyle modification and dietary modification. But in my old space, we never got to do any of that. It was all just, here's a pill, see it in 6 months. So this is
right.
I love doing this type of stuff.
Truly holistic. Yes.
Yeah.
I'm curious, TMS, is that being used for Alzheimer's in particular? You mentioned cognitive benefit, but specifically, is it being used in dementia, Alzheimer's particularly?
Well, anything that can help drive regenerative products to where you want it to go. So there is data that says you can take in TMS and help move regenerative products into the space that's been activated. And we know it works in the orthopedic space. If you put magnetic stimulation over a bone you're trying to heal, that's going to heal faster, right? So, because it draws in the cellular mechanics of things that are going to allow that to heal. So all we're doing is pulling that stuff into the brain appropriately with use of that.
Yeah. And so for folks, even just post-COVID brain,
Right.
COVID
Right.
brain.
We all need that. Yeah.
Yeah.
Right. Yeah. Yeah. But just all, brain, traumatic brain injury. There have been really, what's consistently notable too, and I've even experienced it as well, just noticing it on my wearable, is when the improvement in real sleep, like deep sleep restorative, which is
with TMS, you mean?
Yeah. Our particular device. And it's just, that's really noteworthy. It's exciting. I'm always working on and trying to improve that.
Yes, foundational once again. And you just made me think, Terri, I got over COVID last week. For the first time since 2021, I caught it again, and loss of taste and smell is a big thing for me. And I'm a big foodie. Yes. And it came back in a good 2.5 weeks. I had my essential oils last time, but I'm curious, you mentioned post-COVID. Are you seeing patients? Obviously it's a minor complaint relative to so many other things that you're dealing with. But post-COVID, are you thinking brain fog, but also maybe loss of taste, smell? What other issues with the post-COVID patients are you seeing and you're using TMS for?
Well, there's the just the general cellular dysfunction that happens post-COVID, as far as like chronic fatigue, and those are probably the biggest issues for patients. The chronic can't catch your breath even though you've got normal oxygenation present, so that cell is starving for energy. After that damage that it had, and particularly in the brain. COVID and or immunization reaction can cause significant loss of white matter and dysfunction in the brain. So when you lose smell, it's a cranial nerve. You've damaged part of your brain. When that happens. So, early as you can, you want to be working on trying to get that to regenerate and recover.
Right.
So yeah, we live in that space with some structural support, nutritional fats that can help with cognitive and neural recovery. We dampen the inflammatory response and stabilize the overactive or dysregulated immune response with certain peptides. Then we may use neurocognitive peptides that enhance recovery and enhance BDNF modulation, and then using multifactorial things like the transcranial magnetic stimulation to help enhance that localized area of the brain that might have been traumatized there with that tool. So anyway, it's a bunch of different things that we mix together to help these people try to get better. And they really pop out of the woodwork. They find us. We don't market it or tell people we're the post-COVID clinic because they've already been there and it didn't work. So that's how they end up in our space.
Right. Well, and it's still an issue. So I'm glad it came up. I don't think we've ever talked about post-COVID or long COVID management or practice strategies on this podcast. So thank you so much for bringing that up. And it's one thing of many that you're addressing, obviously.
Well, yeah, I mean, there are a lot of, I guess, syndromes that have come out of that. Just the
Well, whether
recurrence.
it's post-COVID or it's Lyme or it's mold,
Sure.
they're all immunodysregulatory states and dysregulated inflammatory responses. And at a cellular level, that one's hitting primarily in the cognitive space, but also, affects just the whole body. Cardiac function, everything's impacted by that. So,
Right. Yes. So much conversation about post-infectious chronic illness. We talk so much about EBV in this space also, but a lot of people suffer. So I'm sure that that's part of a lot of your patient base as well. And I'm curious on that note, is there a case study using a multitude of these therapies that you can share with us today? Because I would love to hear a success story. I'm sure you have many.
well, I mean, there's a lot. I mean, yeah, I don't know that I'm going to say here's one patient that I have his labs and can pull up right now. It'd be a little hard
Just
to
generally speaking, if
yeah.
there's something interesting, either one of you wouldn't mind
You
sharing.
know, I think the biggest thing is to see, first of all, these patients need validation. They come in, they've been to a bunch of their places already. By the time we see them, they've usually been told that their primary issue is psychiatric and they just need to be treated with some sort of antidepressant.
Right.
And and the point is that what folk point out to them is you didn't have this problem before. You weren't a psychiatric patient before. So maybe this is real and it's at a cellular level that you've been damaged and you have a significant level of dysfunction. It's like peeling an onion away, though, to look at the multiple levels of ways that they don't function properly. And first of all, we acknowledge and validate that they have an issue that's real and it's not just psychiatric for them. So I like to get over that hump with them first. And then we lay out a plan of stabilizing inflammatory response, improving cellular function, cellular efficiency, cellular, flexibility at being able to burn nutrients and assimilate nutrients. We use a lot of ketones because we can bypass that energy production of glucose metabolism, fat metabolism, protein metabolism, and get something in the cell right away. They can at least get some energy flowing for them. And then we look at their global hormonal status and improve function there. We detox them if they've got underlying, multiple levels of toxicity, not just, heavy metals. Or I mean, we look at the whole pattern of things their body's overwhelmed with, which work at a membrane level and then disturb cellular function and membrane transport. So we emphasize that to them. So as we clean those things out, that cell's going to be able to move nutrients in and out better to shuttle electrons and establish redox balance at a better level. So we can't measure those things in real time, but we know that level of dysfunction is there. And that's why we use these tools and these advanced diagnostic ability that we have to help direct that patient and really to engage them to say, look, here's some markers that tell us this is going on. Now we need to work on the process of improving that. So,
Well,
anyway.
Yeah. And in particular, Carl, you remember the one patient that we had who he was actually getting ready to quit his job and leave. And he had a high level job and he was really at his wit's end. He'd been, like we said before, he'd been to all of the big clinics, the post, clinics and had not had any relief and had mentioned to a colleague of his at his workplace that he was just ready to retire early and go home. And his colleague said, my neighbor had good success over at this place, in town, which again, really in town, there's somebody in town, which is always funny to me. But he came to see us. And what was amazing to me, I had the opportunity, actually, one day I was doing those touch point visits, that I mentioned earlier. I got to do his touch point visit. And it was so exciting because and like Carl said, there was like a little bit of a laundry list of some things that we did, but some simple things just to get energy back to his cells that he had a shift. And he said, it's the first time that I can be out in the afternoon and not lose my breath. And like he said, it's not really that somebody's out of breath. It's that perception just from a brain function standpoint. But, just working on that. And some of these tools are so simple, but you have to know to use them to get that response, right? So those things to me are what makes it worth it. I mean, he was not even 60 yet, but he was going to go ahead and just early retire.
I was going to ask his age.
He was done.
Yeah.
He was done. And so it was exciting. I mean, just to see that joy in him, because truly he had been everywhere. Those are those stories that are just so exciting.
Yeah.
Especially the post-COVID ones,
it's
like
the best
that.
part.
Mm-hmm. Yeah.
Yes. Well, we're coming up on time and this has been so wonderful. But before we go, as I mentioned before, you're both so vibrant, no pun intended, but you both are so vibrant and lovely. And I'm wondering, any pearls of wisdom in terms of what you both do for supporting longevity and energy and cellular health and well-being?
Well, I'll start with the simple stuff. It's eat right, sleep right, remain active and exercise. Those, you got to get those foundational things, clean up your environment. We've got a lot of fancy tools that we can use that can nudge things in the right direction. And you should be using some of these tools we use on a day-to-day basis with patients to enhance cellular function, hormonal function.
She asked what you do, buddy.
What do I do? Listen,
I did.
I eat.
Come
I
on.
eat mostly a base paleo lifestyle. I am Irish. I still fail on potatoes regularly.
Okay.
You do a really good job. You can say what
you get some resistant starch there if they're cold.
Yeah. And I take probably 4 to 6 different peptides daily to enhance cellular function and growth hormone enhancements. And I made it to 63 with, I don't have to take testosterone. I mean, I might make my own,
Wonderful.
And there's ways we can help patients make their own. And that's what we try to do, is get you to be able to produce the things you should make on your own as effectively as possible. If you've screwed it up so bad, occasionally we got to give you hormones. Now, ladies are different. They go through menopause and they don't make some hormones. So I got to give them some.
It's my turn in a minute.
All right.
Ladies,
then I use a lot of neurocognitive support. I take regularly use some cerebrolysin. I use transcranial magnetic stimulation when I use it. I use exosomes, systemically. I do everything I can to make my system work as well as it can, because there's still not enough of me out there doing what I do to see these patients. And
more of you, both of you.
Yeah. So I'm trying to keep going until I can train a new generation of people to do this type of stuff. So I have my young doctor who had a patient tell me today, it was like, we come to see you because you're a unicorn and you're so unique and you offer all of these tools that we have. We don't want you to retire. And I'm like, well, I don't really want to retire either. I'm not old enough to do that, but I might maybe work 3 days a week instead of 4 days a week at some point, but I'm not interested in retiring.
You're practicing what you preach and you seem to enjoy it. And that's inspiring.
Yeah.
Yes.
Eat right, I exercise. I use neurocognitive stuff. I play guitar, take lessons. Yeah.
Yes. I've heard you have a band and music, that motor skill with the cognitive function. That's hugely helpful.
It is, it's like physical therapy for your brain, essentially. It's neurocognitive therapy to look at something, to hear it, to touch an instrument. It's integrating all of those senses at the same time. And it's helping to rewire or enhance the wiring that you already have. So it's like always learning something new. Because I just always sight read and read music and play new things, because it's like learning a new language every time you sit down and do that.
And it's never too late, right?
No,
to learn
it's never too late. Never too late.
For me, actually, it's been, it's learning how to take better care of myself. Some things I just have dialed down because I had to, right? When we talked about 2008 and that watershed time for me. So nutrition, diet, those things I can do in my sleep because it was such a lifesaver for me, a necessity. When people talk about, oh gosh, these dietary changes are hard, I'm thinking, don't you understand? This is easy. So those pieces are good for me. As my children have gotten older, what I've been learning to do are do some of the other things to take care of me or to find things that I like. Carl talked about music lessons. For me, I've been so consumed and busy with our businesses and with the family. I read. That's what I do as a hobby or whatever. So those things I am learning now as our youngest is getting ready to be 19. So it's opened up some space for me to do some of those things. But in terms of from a health standpoint, it's nutrition, it's exercise, and peptides for sure. I mean, I use a lot of peptide therapies as well because they work. That they just prompt my body to do things it knows how to do. Maybe forgot.
Yeah, it needs a push.
So support of my growth hormone, not replacing growth hormone, but supporting it, as well as things to help with hair, skin, and nails, of course, right? Peptide therapies for that. Neurocognitive, always. I feel like I lost a lot of brain cells and all those surgeries and babies and everything. So I'm always looking to support that. And, just trying to stay ahead of that curve because same thing, I have a lot of work to do. I have a lot of things still I want to do. So trying to stay as healthy as I can and get better sleep.
Absolutely. Yes, always better sleep. And if I'm hearing correctly, I'm reading between the lines. At first you said, Terri, maybe knowing when to say no and taking back or pulling back in some areas, as much as adding therapies and focusing on our wellness routines. I think they're both hugely important, and those boundaries, and that could, again, be a whole nother conversation. But this was truly inspiring, and it was such a joy to learn about your practice. It seems cutting edge and innovative, and I'm happy to learn about it. I'm wanting to know, where can listeners find you in your practice if they want to learn more?
So medicaltransformationcenter.com. And on our we have a Facebook page, we have Facebook, Instagram, TikTok, Pinterest, LinkedIn, all of the things we're supposed to, right?
Yeah.
But we love educating other practices. We love going out and doing that, whether I do it from the business side, Carl does it from the health side, or from the side, the blood and gut side.
Yes.
And, but we're just appreciative that you've asked us to be on here, that we could share our story.
Absolutely. It's our pleasure. Thank you both so much again, Dr. Paige and Terri.
Thank you.
Of course, yes. And wishing us all vibrant health and wellness until next time.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. And just a reminder, this podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.